At 20 weeks of gestation, you are halfway through your pregnancy journey. This task was completed with great success. Were you aware that only 10% of women actually give birth on their due date? Probable delivery, especially because the ideal is for us to wait for labor, start naturally, at least for the most part. In some cases, some types of gestation, risk, for example. It won't be able to wait, but if that's your case, shall we? Make a pool. Will people get the due date right? Tell me here, what is the probable date of your delivery? I'll find out. Including, when is that? Are you watching this video? Now, if you are eager to learn all the latest updates about your body, what should you do? That is changing special attention. Your baby? Size like what? Here's a video of this delightful cuteness. Food tip and a special tip for this week. This week, see? Very important. Then stay with me, that I'll find you. Hello, I'm Monica Romero. Nice to meet you. I'm absolutely thrilled to have you here with me. This midway point is crucial, and you truly deserve it. Think about all the experiences you've endured, right? Was it morning sickness? It was anxiety in the belly. That doesn't suddenly appear, boom. There's a big belly there, the baby that doesn't move all of a sudden. Boom. Is there a baby moving? There's so much exciting stuff happening, and when I want to talk about you now, I'll get right to it. Regarding the latest news about your uterus, just take a look at the details. How much is your belly already? It has grown compared to the first day of yours, pregnancy. And now your uterus is right over there. Measure from the height of your navel and go. From that moment, he will begin to climb every hour, get higher, sort of. Centimeter per week, and that's why the height, uterine. It's what? It's worth it when we go. What about development of your pregnancy? It's not merely about belly size, but rather uterine height, which the doctor will measure from the pelvic bone. From the pelvis to the top of the uterus, right? Indeed. Measure, which we will take away so we can see how the development is going of your pregnancy. And it is because of this position, uterine, that you may start to feel a visual change even in your navel. It may start to become flatter or projected, and we start to feel more sensitivity. It's a little sore, this one. The navel region is not for 100% of pregnant women, but most feel tenderness at this waist height. And that's why you come here. A tip from Donna Monica. You know those people who can't see a pregnant woman will already put their hand on her belly? Oh yeah. There are people who like it, but when it's not a person we have a lot of intimacy with, we don't want them to keep putting their hands on us. So my tip for you, so you can handle this situation. How do you, by any chance, someone goes with their hand on their belly? You already said that. Look, don't touch it because my belly is very sensitive. I'm in a lot of pain. So I'm just asking you not to touch. It's our way. Get rid of this situation, preserve our space. Our touch is on the belly there, only for those we want. Because there are people who really fall in love with a pregnant woman on the street. I, for one, am charmed. I can't see a pregnant woman on the street that I already start smiling at times. I'm so excited because, guys, as I love this world, I love this maternal world, I'm really delighted, but I know that the hand on the belly is only for the intimate, okay? And like every week I come to talk about blood flow. You knew it increased so much that your heart is coming to circular sept, liters of blood per minute. This implies that your veins are now considerably wider. Also, not only the flow faster, but to be able to accommodate this increase. All of them, they got wider. And what? This leads us to notice more prominent veins and additionally brings more heat. We tend to get hotter during pregnancy and might sweat more, particularly beneath the breasts, under the armpits, and in the vein, there from the thighs is warm us. It is. With clothes there that are kind of synthetic, a skirt, we start to sweat. E. How am I discussing our region over there in Vaughan, right in the middle of the thighs? We have a lot during pregnancy, something called Leucorrhoea. The name is ugly. But don't worry, it's just increased vaginal moisture. We produce more mucovaginal mucus during pregnancy. If that mucus. He has yellowish, smelly, itching with some irritation. Consult your doctor for guidance. What could it be? Candidiasis or something else? What's the bacteria? Proliferating beyond what it should, as it is a humid and hot region. This condition promotes bacterial growth in this region. Hence, my advice is already provided. Other videos, I will talk again. If you work outside or will be outside for a long time, in addition to wearing cotton panties and fabric clothes, natural that allows, right? Perspiration, because the price of synthetic materials suffocates more if you are wearing appropriate clothing, you still have to deal with this humidity. Put an extra cotton panties in the bag, put there in a bag, in a little necessities, and you change during the day these panties that will bring you more comfort. You will feel better, because unfortunately, Leucorrhoea only tends to. Will it be better afterward? I'm leaving. And you are likely aware. Isn't your little baby here with you as well? Each week, the Parents' Almanac offers a video. You about the development of your baby. What about your pregnancy and you already know he is? Extensively trained. Oh, what do you mean? That much is now being focused on his weight gain. And what? What does this have to do with you? That your hunger will increase yours. Appetite, or has it increased, or are you starting to notice yet that you're starting to get extra hungry that way? Weight gain during pregnancy varies greatly from woman to woman. It also depends on the climate you're in. However, most of the gain is now at the end of pregnancy in this second half, especially in the third trimester. But if you're with, is excessive hunger and weight gain a problem for you? Pay attention, pay close attention. Even in what you're eating. I mean, everything. It's white flour, try it. Exchange for points, would she satisfy you? For longer? Increase the amount of protein also helps maintain satiety for a longer duration. Talk to yours doctor. Or if you consider consulting with a nutritionist or endocrinologist for advice to help you do it. Ideas for healthy snacks so you can keep your hunger under control, because there is hunger pregnancy itself. And a question, have you already scheduled to ask to schedule last week or already performed the morphological ultrasound of the second trimester? In most cases, it is performed at 22 weeks, but sometimes due to schedules or even due to the doctor's preference. Can it be done? Before, now at 20 weeks or 21 weeks, and it's a super important exam. What are you going to evaluate? Various aspects of not only your baby, but also your placenta. So don't forget, and I'll be back, I'll leave a link here now. About yours? Ultrasound, and I'll play it again when I've talked about yours. Baby what? Now let's have a detailed discussion about your baby. It's already the size of one bell pepper, measuring between 16 and measuring about 18 centimeters from head to toe. Boom, boom. Weighing around 260 grams. Grams earlier this week and could almost hit 300 grams by week's end. You're really helping this kid gain weight, aren't you? And he's swimming in 320 milliliters of amniotic fluid. Plenty of liquid there for him to swim, but he's already stronger. He already begins to push with a little more voraciously the wall of the uterus. What do you mean? That we begin to feel the movement of our little baby more and more. So far, by 20 weeks, most women feel their baby stirring for the first time. And if you've ever felt it before, you have already identified this change. Now, the trend is to just increase not only the strength, the intensity, but also the hours you will feel it. And because before it moved, we didn't even feel it. Now it's going to be hard, isn't it? Feel our little pup, your ear. The exterior has a design. What are you doing with that sound, even though he was there immersed in 320 mLs of amniotic fluid? Penetrate further. Laterals doing it. Listen, better ours. Voice he is, acknowledging yours. Voice then, we talk a lot with this little baby because as soon as he is born and he hears our voice, smells our smell, puts him like this close to us, he stops. Crying is truly magical. It's an indescribable, marvelous feeling that is immensely worthwhile. I'm going to leave you now drooling in this video of how is your puppy faring while I tell you about yours. The skin has become more pinkish, whereas earlier it was somewhat transparent and now it carries a slightly pink hue. The case is Vernix that covers yours. The skin has a faintly whitish substance, a little greasy, oily. This substance protects the baby inside the womb while it is immersed in amniotic fluid. However, as a postpartum guys, don't you bathe your baby as soon as he's born? No, we're just going to clean this little baby and the bath will happen. Why 24 hours later? The reason is that we found that the Vernix is amazing to help the baby control your body temperature. When does it come out of the womb? It also helps protect your skin with it. Change, of environments. It used to be liquid. Now it is in the environment that we are in, the external environment. It helps too. And it also has extra hydration there for the skin that is super, super interesting. He is trained by LA. Nugem, which are these hairs that cover the baby by epithelial cells along with glands. Sebaceous. If you're expecting a big boy, your remaining testicles are gone. I graduated just last week. Let's go. Get off now. Will the pelvis stay longer? Down in that position. Even traditional men, if you're a little girl and all your eggs have been formed since last week, what's developing now is your vulva. Which is that part of the sexual organ? External. Are you ready? Suddenly feeling your belly jump. Your child might have been startled. How is he hearing the sounds? Some noises. Sudden or high movements can make him jump, and along with his jump, he caused ours. Heartbroken of, knowing he got a scare. But you can also feel the belly. With the jump, your baby might be hiccuping, which means what the whole system? Breathing of yours, little puppy. Is it complete? Your lungs are still developing and not fully mature yet. He does. Of a liquid that will allow the alveoli. If they expand and contract, this liquid is called surfactant liquid. And the last thing that's going to be left, you should prepare for your baby around the 37th week of pregnancy when they are single babies and fully developed. Twin situation, this surfactant liquid is ready sooner. Look, as nature is wise, is because most pregnancies are multiples, right? Are they coming? Up to 40 weeks. And that's why, because of this liquid surfactant that we say what? Baby is ready to be born from 37 weeks. From 37 onwards, he will no longer be a premature baby. Will it be a ready baby? Exactly. Because of that? But that's the last thing. And now I'm going to talk to you. Give me a quick summary. Because the full video I've already left it in. Home, and I'll leave one more here. Oh, another video about morphological ultrasounds. Oh, what is varied? In this morphological ultrasound, what will you accomplish for now, between 2022 and now? 23 weeks, but the doctor. Here you go, matching you, okay? This will evaluate the baby's heart, and it's 4 cameras if they are all well formed. He's going to assess brain development. You're going to evaluate the baby's kidneys. Are they getting the fluid that he is swallowing and then expelling it in the amniotic fluid, as we have already talked a few times about urinary therapy for our babies. He will also evaluate everyone else, the baby's organs. And one important thing to see up, measure of the baby he will have. What exactly is the measurement of the head size? Baby, and which one? It's equivalent to the femur's size, providing a sense of dimension. Your puppy's size can vary within these parameters. Measures that I speak here to us. Videos, because they are measurements. Approximately, I'll pass it on to you. Your baby will be his size. And one thing a lot. Cool is that you can maybe do a 3D ultrasound or forget that photo. Oh. Here's the initial close-up shot of your adorable puppy. Please ask. To print this photo is the hottest thing. To see, and you? When will your baby be born? Will you be able to compare and find various features like the little mouth, the lip, the little nose? Eye position is everything. Instead it ends. This is an exceptionally popular photo for us to view. And lastly, that they will also evaluate, is that yours? Placenta gave spoiler when it was. Speaking of you. And why is that? Because the placenta isn't just that fluid amniotic sac that surrounds the baby. No, the placenta is an organ that we only have. Create this organ during pregnancy, and she is responsible for exchanging the mother's blood for the baby. He will receive through the umbilical cord this blood to him. And are you going to change this one? Blood with him through this organ called the placenta. The placenta, she is also, after childbirth, we proceed. Give birth to that placenta. Only she has a position suitable for her to be, then she the largest, best position for her, the normal placenta. It will stay there at the top of the uterus, according to the photo I'm showing here. To you, the picture is not the image I am showing it here for you. But she might be in the middle of the road, let's say so, right? In the lateral serranes. Or possibly she could be situated down below when she's there. It's a placenta. Previous, what about her? Requires special care. But I have a video that I speak better about it. I'll leave it. Here's the link for you if that suits your case. And now I'm moving on to my tip. Do you enjoy the food for this week? Of water. I love cocoa, but I'm not talking about these artificial ones. I'm not talking about that one. Water of coconut, which we open and drink when it's very cold too. To have very nutritious properties. Good. It also helps in the functioning of the intestine and also to decrease fluid retention. So my tip today, rather than just giving food tips, this one is about a drink. Absolutely wonderful and extremely hot. Super nutritious. And coconut water if you like. Enjoy it. And a tip of the week will be 2 tips that are a lot important. The first, a helpful tip is, are you feeling upset regarding your gender? Baby, You expected it to be a boy and it's a girl, or did you expect it to be a girl and it's a boy? Did that upset you? Did it hurt you? It's normal. We create expectations, we create dreams, and sometimes, as they are not, they don't turn out as we planned. We can feel a little annoyed then. What? I'll ask you. It's that next. First, the sex of baby is just a feature. What physics will he have? And it's important during greatness. It's important because of dreams. But who will your son be? Who will your daughter be? It's much more than the genitals may indicate the potential of being a super boy, mother's or father's companion, a super father's or mother's companion girl, or all of them. The humor, the way of acting, the way of thinking, the way of playing, the way of being by your side. I have a couple, I have a boy and a girl, and I'm going to talk to. You surpass my wildest expectations in every way, and it is unrelated to their sex, but rather to their personality traits. So at first we can say for a while, upset because I wanted a boy or because I wanted a girl, but what I need to inform you is that they will present you with significantly more beyond that. Are you right to be upset? I understand that you are, but calm down, this will pass. There are things much more important than that. What about character? Theirs is the primarily, but we can only achieve this. Discover and develop, then I'll kill you. So don't get attached. A lot of that, now it gets a little sad in a little while. You'll start to get used to the idea. After you, if you get used to this idea, you will start to enjoy many other things. Continue here in the Parents' Almanac. I will leave this video linked to. You about this one? I assure you everything will turn out fine. What exactly will work? Also, my second recommendation is this. What about the father of this baby? He is actively engaging with the pregnancy. He's giving you his attention, being a considerate partner, accompanying you to medical appointments. Fathers can often feel quite confused due to a couple of reasons. The first is not knowing exactly where. It's just that he's more into that relationship. He knew before, especially when he was the first child, he gets more lost. He knew he was there, he was. The husband, boyfriend, lover, and friend. And now who is he? He has such a close relationship with you. Where does he fit in, baby? That he still doesn't know where he fits in? And then when we can help, we absolutely should. Help by taking him to see the ultrasound to live this baby. We can help with conversations. Explaining to him that before he was the son and now he is the father. That if he has a good image of his father, for example, as a gift protector, cool images that today he can represent everything for the son. And if he doesn't have these cool images, look what an incredible opportunity he has to create them. For his own son, he can. Do you get the idea now? That he's the father of home. He's the father of a little baby who, you need him a lot. You have a lot to learn from him. But it's not just this baby who needs it. You need it too. You, mom, need him too. You need it when breastfeeding. He can help you. He can help you by bringing the baby to you, accommodating you in a nice place, bringing you a glass of water. He has the ability to assist you in getting up from the chair. With that huge belly, because it's not easy, he can help you with all of them. The household chores, you should have been helping all along, right? But him, can I help you? With so much more. When he becomes a father, he gains a new, much more important assignment. Any position he might have in the company, much more important than any other achievement, any money in the account, he will earn a living. What about this life? It's been amazing since, may he be near participating. If he's struggling to see yourself in that place, please ask him. Ask what are the fears, difficulties. My husband, for example, he only wanted to work because he began to think that his function was to provide, to bring money. There's no shortage of food. He started working hard, and suddenly when Lucas turned 1 year, he realized that he had lost a lot of Lucas. He didn't see much because he was working. And he noticed, I said, no, I have to work. But more important than working is being a father. Then I'm going to be a father. So he started to, it divides, better time. But it took him a while for him. Understand, who knows, you can. Wake up now, yours. Partner or your partner? For this new moment of you in that family. Of you, be it. Undoubtedly beautiful, exceedingly united. Very nice to be here. An incredible family environment for the development of this child and for their happiness as well. I really hope you enjoyed this video. Congratulations on your 20th week of pregnancy. Don't forget, my love. And I'll see you in the next video.